Welcome back, everyone. Let's dive into today's practice questions together and break down not just the correct answers, but also why the other choices don't quite make the cut. Let's have fun, learn, and feel confident about tackling this exam. Let's start with question 1. A 45-year-old male presents with a history of depression and reports feeling excessively tired, gaining weight, and having difficulty concentrating. He denies any suicidal ideation. Which of the following lab tests should the PMHNP order first? A. Complete blood count, CBC. B. Thyroid-stimulating hormone, TSH. C. Serum electrolytes. D. Liver function test, LFT. Pause the video if you need more time to process this one. Make sure you're comfortable with your answer choice. So the correct answer is B. Thyroid-stimulating hormone, TSH. Symptoms of fatigue, weight gain, and difficulty concentrating are red flags for possible hypothyroidism. Before adjusting or initiating antidepressant therapy, it's essential to rule out underlying medical conditions. TSH is the gold standard to screen for hypothyroidism, making it the best initial test. Here's why the others are incorrect. A. CBC is useful for detecting anemia, but anemia doesn't explain the full symptom picture here. C. Serum electrolytes checks for imbalances like sodium or potassium, but this test is not specific to symptoms mimicking depression. D. LFT, important for liver health but unrelated to hypothyroidism or depressive symptoms. Question 2. A 32-year-old female presents with complaints of anxiety, palpitations, and insomnia. She states that these symptoms began 2 months ago after she started a new job. She denies any past psychiatric history. Which of the following is the best initial treatment approach? A. Initiate alprazolam Xanax. B. Start cognitive behavioral therapy, CBT. C. Prescribe sertraline Zoloft. D. Recommend dietary supplements for stress. If you need more time to think through this question, hit pause and review your answer carefully. Correct answer, B. Start cognitive behavioral therapy, CBT. So for a patient with new onset anxiety, especially one related to situational stress, CBT is the best initial treatment approach. It helps the patient develop coping strategies and manage anxiety without immediately resorting to medications, which can have side effects or lead to dependency. Here's why others are incorrect. A. Alprazolam is a benzodiazepine and can lead to dependency if overused. C. Sertraline is an SSRI and generally not first line for situational anxiety. D. Dietary supplements lack strong evidence for treating anxiety. Let's do question 3. A 70-year-old male with a history of dementia is brought to the clinic by his daughter, who reports that he has become increasingly agitated and aggressive in the evenings. Which of the following interventions is most appropriate to manage this patient's symptoms? A. Prescribe lorazepam Ativan. B. Increase social interaction during the day. C. Start risperidone Risperdal. D. Recommend light therapy in the evening. Correct answer, B. Increase social interaction during the day. In this case, the patient is likely experiencing sundowning, a phenomenon common in dementia where symptoms worsen in the late afternoon or evening. Increasing daytime activities and social interaction can help reduce agitation and aggression by improving sleep patterns and reducing overall daytime napping. Here's why others are incorrect. A. Lorazepam can worsen confusion in dementia patients. C. Risperidone can be effective but has a risk of serious side effects in elderly patients. D. Light therapy is less effective compared to increasing daytime engagement. On to question 4. A 28-year-old female presents with panic attacks that occur several times a week. She describes intense fear, palpitations, and shortness of breath during these episodes. What is the first-line treatment for panic disorder? A. Diazepam Valium. B. Sertraline Zoloft. C. Mirtazapine Remeron. D. Buspirone Buspar. Need more time to reflect? Pause the video and double-check your reasoning before you proceed. The correct answer, B. Sertraline Zoloft. SSRIs like sertraline are considered first-line treatment for panic disorder due to their efficacy in reducing the frequency and severity of panic attacks without the risk of dependency associated with benzodiazepines. Here's why others are incorrect. A. Diazepam can be addictive and is not recommended for long-term use. C. Mirtazapine is more effective for depression than panic disorder. D. Buspirone is primarily for generalized anxiety, not panic attacks. Let's do question 5. A 52-year-old male with a history of alcohol use disorder presents with tremors, sweating, and agitation 48 hours after his last drink. What is the best management for this patient? A. Administer thiamine. B. Start an SRI. C. Prescribe lorazepam. D. Encourage hydration and rest. The correct answer is C. Prescribe lorazepam. Benzodiazepines, like lorazepam, are the treatment of choice for managing alcohol withdrawal symptoms, including tremors and agitation, as they reduce the risk of seizures and delirium tremens. Here's why others are incorrect. A. Thiamine prevents Wernicke's encephalopathy, but doesn't treat withdrawal symptoms. B. SSRIs are not used for alcohol withdrawal. Dehydration alone does not prevent severe withdrawal complications. Next up, question 6. A 16-year-old male is brought in by his mother for an evaluation of mood swings and irritability. He denies any drug use and reports that these symptoms have been ongoing for several months. What is the most likely diagnosis? A. Bipolar disorder. B. Major depressive disorder. C. Attention deficit hyperactivity disorder. D. Generalized anxiety disorder. Correct answer, A. Bipolar disorder. Mood swings and irritability in adolescence can be indicative of bipolar disorder, particularly when these symptoms are persistent and not better explained by substance use or other conditions. Here's why others are incorrect. BMDD lacks mood elevation phases. C. ADHD symptoms typically include attention deficits rather than mood instability. D. Anxiety does not typically present with mood swings. Here we go. Question 7. A 45-year-old male with a history of schizophrenia presents with a new onset of involuntary tongue movements and facial grimacing. Which medication is most likely responsible for these symptoms? A. Clozapine. B. Haloperidol. C. Olanzapine. D. Risperidone. Correct answer B. Haloperidol. Tardive dyskinesia, characterized by involuntary movements, is a potential side effect of first-generation antipsychotics like haloperidol due to their strong dopamine-blocking effects. Here's why others are incorrect. A. Clozapine is associated with a lower risk of tardive dyskinesia but carries a risk for agranulocytosis. C. Olanzapine is a second-generation antipsychotic with a lower risk for tardive dyskinesia. D. Risperidone has a lower incidence of tardive dyskinesia compared to first-generation antipsychotics, but can still cause it with long-term use. Progressing further to question 8. A 35-year-old female with a history of generalized anxiety disorder reports worsening symptoms despite being on a stable dose of an SSRI. Which adjunctive treatment might be most beneficial? A. Bupropion. B. Buspirone. C. Mirtazapine. D. Aripiprazole. Correct answer B. Buspirone. Buspirone is a non-benzodiazepine anxiolytic that can be used as an adjunctive treatment for generalized anxiety disorder when SSRIs alone are insufficient. Here's why others are incorrect. A. Bupropion is mainly used for depression and smoking cessation, not anxiety. C. Mirtazapine is typically used for depression and can cause sedation. D. Aripiprazole is an antipsychotic used for treatment-resistant depression or bipolar disorder, but not first line for anxiety. Next question 9. A 22-year-old college student presents with symptoms of restlessness, difficulty concentrating, and an inability to sit still. These symptoms have been present since childhood. What is the most appropriate diagnosis? A. Major depressive disorder. B. Attention deficit hyperactivity disorder, ADHD. C. Generalized anxiety disorder, or D. Bipolar disorder. The correct answer, B. Attention deficit hyperactivity disorder, ADHD. Symptoms of restlessness, difficulty concentrating, and inability to sit still that have been present since childhood are indicative of ADHD, particularly if they impair functioning in multiple settings. Here's why others are incorrect. A. MDD typically involves persistent low mood and lack of energy rather than hyperactivity. C. GAD is characterized more by excessive worry than hyperactivity. D. Bipolar disorder involves episodic mood disturbances, not chronic hyperactivity and inattention. Last question, 10. A 65-year-old male with Alzheimer's disease is prescribed Donepezil. What is the primary mechanism of action of this medication? A. Inhibits NMDA receptors. B. Blocks dopamine reuptake. C. Enhances cholinergic function. D. Inhibits serotonin reuptake. The correct answer, C. Enhances cholinergic function. Donepezil is an acetylcholinesterase inhibitor that works by enhancing cholinergic function in the brain, which can help improve cognitive function in Alzheimer's disease. Here's why others are incorrect. A. NMDA receptor inhibition describes memantine's mechanism of action, not donepezil. B. Dopamine reuptake blockers like bupropion are used for depression and ADHD, not Alzheimer's. D. SSRIs inhibit serotonin reuptake and are used for mood disorders, not Alzheimer's management. Great job so far. If you've been pausing the video and reflecting as you go, you're using an awesome strategy to retain information. Keep up the great work. Let's tackle the next set of questions in the next video session. Also, I'd love to hear from you. Comment below with your thoughts on today's questions or share which topic you'd like to see covered next. Your input helps shape future videos.